This is Dr. Susan Little.
Yeah, we're very excited. So, once again, this is a podcast without a name still.
Yeah, it's a new podcast, and maybe our guest on this podcast can brainstorm with us. So we have a new podcast that is helping cat owners understand cats and cat medicine, but it has no name.
No, not yet. We had a couple of names, though.
Yes. But
so what's a good name? So catnap, we had catnip.
Cattails.
Cattails.
I like cattails.
Cattails.
What do you think of Meow Minute?
A Meow Minute?
Yeah.
I think
Meow Minutes?
Yeah, it'd have to be Meow Minutes.
Yeah?
But I like that as well.
Oh. Yeah, which one is better,
Cattails. I'm kind of torn between the two. Let me see at the end.
Okay.
And then I'll make a decision.
And catnap, you don't like catnap?
Well, I think...
It's nice and short.
I think as a previous guest pointed out, we perhaps don't want people to sleep.
That was what it made me think immediately. Catnap, so I'm going to fall asleep in the podcast.
Yeah, maybe that's a good thing, though.
Oh.
You know,
well, if it cures
sleep.
Insomnia, then people
need to sleep
that
more. Yeah, that's at least my idea. But but it's great to have you. And who are you?
Oh, I'm Michael Lappin.
Mm-hmm. Dr. Michael Lappin. Yeah.
That's right. I forgot that part. I'm from Colorado State University. Mm-hmm. I'm an internal medicine specialist there that likes cats a lot. Mm-hmm. And I work mainly with infectious diseases, things that you might catch.
Or that cats might catch.
And we have a couple of rules during this podcast. One is no D word, but you know already about that rule. The other thing is no difficult word. So we stop you when you say a difficult word, and then you have to explain it. And yeah, that's all.
So I think one of the cool things that you do that cat owners might be interested in is that you're part of what's called a One Health Committee. So let's talk a little bit about what does One Health mean, because we hear that phrase a little bit, right? Mm-hmm. And it's really trying to unite human health and animal health, not just large animals, but small animals.
And focus on the cat.
Absolutely, yeah. So we do have a group of veterinarians called the World Small Animal Veterinary Association, and we now represent 120 associations.
Around the world?
Yeah, around the world, and about 200,000 delegates, most of which are veterinarians.
Wow.
And we're really having the mission of trying to advance companion animals on the world stage, of everybody living together and being healthier. Mm-hmm. The animals with 2 legs, the animals with 4 legs, and how we interact with the environment. Mm-hmm. And cats are actually a great part of that because they make people happier. Mm-hmm. So having cats is probably one of the happiest things in our lives at my house. And anytime I'm feeling a little bit sad, I think about getting another cat.
Oh, excellent. How many do you have?
Yes. Right now we just have 5. But in the future, I have to fight not getting depressed so I don't get more cats.
So you have 5 cats. What are their names?
Yes. Well, we have Karen Grace.
Yes.
Grace. We have Bonnie.
Bonnie.
We have another 2 that are just coming. There's a little bit of a debate
about the name.
But yeah, one of them's going to be called Gelpy, which is a surgical.
I like that. Yeah,
that's
a cool name.
Yeah. What is it?
It's an instrument. It's
a surgical instrument.
Yeah, it is. Yeah.
My gosh, Gelpy. You guys are geeks. Okay.
Yes, and his brother, and they're both right at 6 kilos of muscle. Mm-hmm. These cats are huge, big orange boys. But we think the other's going to be named DeBakey.
DeBakey, which is a surgical instrument.
They're surgical.
DeBakey forceps.
Yes. So we should explain.
Wife is a surgeon,
my wife,
Dr. Lappin's wife is a veterinary surgeon.
She's a surgeon.
Hence
I
surgical instrument names.
And I think the audience will like the 5th cat was actually named Henry because he was orange. But then when I was doing a physical exam and looking at the backside, I noticed that it didn't have a circle like a little boy would have. It actually had a slit. And so it was actually a girl cat
that
was orange.
Which is not common.
No. So we had to change her name from Henry to Henrietta.
Henrietta?
Oh, really?
Yeah. And my
so
loving...
she is a Klinefelter, or which is a difficult
No.
But what was funny about it, though, is that my wife, after she met Henrietta, really wanted her because I loved her and I wanted to bring her home. And so she said yes, but she wanted to name her something else. And so she named her Pippa, like Pippa Middleton, I think.
Pippa, like Pippa as in Pippa Middleton.
Yeah, the wife's from the United Kingdom, and so that went over pretty good for a while. But then she changed it again, and so she named it Jenny with a G.
Okay. Jenny with a G.
Jenny with a G, and she thought she was
from
cute.
The block, or
well, no, actually, I'm not exactly sure where the Jenny part came from, but she calls her Jenny Scone, like the biscuit.
Okay.
Because she's cute as a biscuit. But then we had to change her name again.
Where is this podcast going?
Well, this is how cats get named.
This is how they get named. So now we have Jenny Scone, who's cute as a biscuit.
Yeah.
But then she got a little bit heavy initially after she came home with us.
Too many
biscuits.
We
fixed that. Well, now, so we changed her name again to Jenny Ate Too Many Scones.
That's so funny.
But we actually have a cat wheel, one of the big giant hamster wheels. Oh yeah, and Jenny, she works out on that daily.
Every day.
She truly does.
Really? Do they all use it, or
nope? Just Jenny, because she knew she had a problem. She is a little bit heavy, problem. So she did.
Anyway. So that's the 5
So the
cats.
other cats are not using the big wheel.
Nope, the other cats. Now we haven't brought the 2 big boys back yet, so I'm hoping that they'll use it as well because I paid $200 for the. I'm hoping some cats will use the darn thing.
Hoping more than Ginny will use the $200 cat wheel.
Yes. But I am so excited to be on this new unnamed podcast because I have a message that I wanted to get out there.
Please go ahead.
Yeah.
That's
What's the
purpose.
message?
Well, my message, and I already snuck it in, is that, people are better with pets, as one of the pet food companies says.
Yep.
And the Center for Disease Control, their tag is Healthy Pets, Healthy People. And that's really what we're talking about on our One Health from the companion animal veterinarian side, is that pets actually do help us a lot with our happiness, self-worth. And the message I wanted to get across is that anything we can do to be happy is probably going to improve our life and maybe even longevity.
Mm-hmm.
Yeah,
much healthier to be happy.
Yeah, did you know that happy people might actually have stronger immune systems?
I bet. I'm not surprised.
Yeah.
Surprised.
Yeah, it's really good. So cats are really, really, really good for you, even though sometimes people are afraid of them.
Yeah, and I think that it's a good point that you bring out, because if we talk about One Health, so that's really the interface between veterinary medicine and human medicine and nature medicine and all those different facets of research, and very often there's a focus on the negative part. So what diseases do we get from animals or whatever, and very rarely we talk about the fact that cats give us so much joy, and if you're joyous and happy, you live a better life, and you'll probably live a longer life too.
Yeah. In fact, I think we've distilled it down pretty well with that WSAVA group, and then the American Association of Feline Practitioners. Again, the Americans, they have guidelines about what you can catch from a cat, because every vertebrate has some organisms that could go back and forth. You could catch something from an animal. But the good news is, the message is, if your cat is healthy, so no vomiting, no diarrhea, no coughing, no sneezing, no pus coming from any body part, no skin disease, and then if you're doing your dewormings, which we now know is probably good to do deworming all the way through adulthood, not just kittens. So if you
all through the year, too,
yeah, we have to do it multiple times. That can help you make the decision which are the best products for your area. But it's definitely all the time. And then if we also control fleas and ticks, then the odds of catching something from a cat are almost zero. And so it's really that simple. If your cat's sick, go to the vet.
Yes.
And then while you're there for regular vaccines and things, make sure we do the parasite control.
Yeah.
And then things like rabies vaccines, because rabies can come from cats to people. If you do those things, the odds are that pet's going to be more helpful to you than any danger. And that's our message.
Yeah, that's exactly it. That's exactly it. And sometimes, cats get sick, and we talk. in another podcast for veterinarians more about, so if cats get sick and they might get diarrhea and that sort of things, then you have to be a little bit more careful. And so what are some precautions that you should take as a cat owner dealing with cat poop in general?
Sure. Yeah, I think there are several really important things to remember, and that's wash your hands frequently with any animal, and including cats. Even though they're quite clean, we still need to wash our hands a lot, especially after cleaning the litter box or cleaning up in the garden. If you find cat poop outside, make sure you wash your hands, or wear your gloves when gardening. Yeah, don't chew your fingernails after gardening and after cleaning the litter box. Probably very important to feed processed foods, because sometimes some of the raw food diets can have more bacteria than normal, and some of those bacteria could be magnified by the cat and then infect a family member.
That has happened.
Oh yeah, it really has.
That has happened.
Yeah, but I think as long as you're doing a lot of hand washing and preferably cleaning the litter box on a daily basis.
Yes.
Yeah, some of the parasites, they take 1 to 3 days to become infectious.
Okay.
They wouldn't infect a person on day 1,
exactly.
but on day 3. And so if you clean the litter box every day, then you can avoid those types of infections as well.
And the cat likes it better because it's a clean litter box.
Yeah, and then they're less likely to
poop on the floor.
Or poop somewhere outside the box. You got it.
Yep. So these are really simple things, and it's like following your vet's advice and getting regular veterinary care, right?
Absolutely.
Yeah, and then we can take better advantage of the benefits of having a cat in our life.
We're really happy to have medical doctors now on both our AAFP, the Feline group, as well as the WSAVA committee. We actually have physicians on the committee with us, and they give us information that suggests that your medical doctor actually does want to talk to your veterinarian.
Yeah.
Because we have a lot of training in the companion animal side. They have a lot of training in the two-legged animal side. But we should work together to help make decisions. Say if you're pregnant, for example, there are some extra precautions that we would like to take, but we wouldn't have to get rid of the cat.
That's a good point, right?
Yeah.
Do you think there, I'll be interested to see what you think, but I think there's still the occasional doctor who recommends that.
Occasionally there is, and that's why I think with the One Health concept, that's not what they focus on. Right. We focus on animal diseases. They're focusing on other things that are more common in people, like hypertension and the cancers and things. And so when an issue comes, that's where we share our information.
Yeah.
But I'm really pleased with the physicians that we've been working with, because they've been quite open. They want input from veterinarians. And so I think we shouldn't be shy to ask our veterinarian to talk to the physician, or to ask our physician to talk to the veterinarian.
Yep.
That's the whole One Health concept.
Yep.
And then we're talking specifically about what we call zoonosis, or diseases that either you can give the pet or the pet can give you.
Yes, yeah. Any organism shared between animal and man.
Yeah.
Yeah, so two-legged and four-legged animals.
Yeah. No, those are important things, at least to talk about. And I remember because I was part of the One Health Committee for a long time too, when we started talking was more also about re-educating, because for us, for instance, if we talk about rabies, every veterinarian knows what it is, how important it is to prevent it, how important it is to vaccinate dogs against rabies, and cats. Obviously. But for human physicians, they know about rabies in a completely different way, and they are not as often in contact with rabies information in general, or you never see a rabbit person,
right?
Hopefully.
Well,
but a lot of people don't realize that rabies, for instance, in the U.S. is still there.
Oh, yes. We have little outbreaks of rabies all the time. Many states have either bat or terrestrial rabies, and things like skunks. Yeah. And so it's quite important that your cat actually be immunized against rabies. it's because of the potential human health issues.
Even indoor cats, because of bats.
The bats.
And I think that what people don't realize is that there's still 60,000 people per year dying from rabies
around the world.
Around the world, obviously more in less developed countries because they don't have as much protection and they don't have really good vaccination schedules for roaming animals.
Yep.
But it is still a very deadly disease in this time, which is, if you think about it, if we would vaccinate most of our domestic animals, probably the incidence of rabies would be a lot lower.
Oh, absolutely. It's totally vaccine preventable.
Yeah.
In fact, we're in a country right now that is intermittently rabies-free, and the United States has not achieved that, but we've made great strides. So many of those human deaths are occurring in countries like India, as you mentioned, where we just can't get enough doses of vaccine into the animals in the environment
to protect
to
people.
stop that. Africa as well, and that's what's so exciting to see the initiatives around the world right now trying to combat that particular problem.
You can't let your guard down, even in a country like Canada and the U.S. where vaccination rates are higher. We have an outbreak in Ontario, Canada that's been going on for some time now in animals like raccoons and so on, and so it's a threat.
It's a threat.
And this brings me to another topic to finish this podcast, is that we also now find out that on the animal side that owners are more hesitant to vaccinate their animals, and this kind of spills off from the human side. You have a lot of the anti-vaxxers coming in. What is your feelings about that?
Yeah, there are a lot of issues, obviously, with the human side, with the probably unlikely link to autism. And then from our cat side, it was the link to potentially developing a tumor under the skin where the vaccine had been given. And Jolle's been a surgery person in that oncology world, and Susan and I being medical people dealing with that problem. Well, the good news for the folks listening today is the companies that make our vaccines in the last 15 years have done a lot of work to remove a lot of the contaminants that may have been there in the old days. And we now think that risk of a tumor in the cat may be somewhere between 1 in 10,000 cats and 1 in 50,000 cats, depending on which recent paper you read. So the odds of having a vaccine reaction are actually much smaller than the odds of getting some of these diseases. And so it's a probably a negative thing to not vaccinate, more so than dangerous to vaccinate. Our biggest issue, honestly, is getting cats to the clinic,
into the clinic,
because they're a little bit difficult sometimes when it comes to that. But we have lots of new strategies about how to get the cats to the clinic, and we're all making our cat clinics more friendlier to cats,
less stressful.
And we have veterinarians now that do also house calls in case that you cannot get your cat to the clinic. So there's lots of options there. But I think vaccinating your animals is so important that we should not underestimate.
Not just for their health, but that's part of what protects our health too.
Yeah, exactly.
Absolutely.
That's good.
Great topic.
Yeah, that's wonderful. So thank you so much for being here and talking with us.
Especially about the whole One Health concept. It's very exciting.
Yes, cool. Thank you for having me.
And if people want more information, where can they find it?
Yes. You can go to WSAVA.org. So WSAVA.org, and look for the One Health Committee, as well as our vaccine guidelines group.
Great. Thank you so much.
We'll put a link in our show notes on our website too.
Absolutely.
Thanks, guys.
So, this has been awesome.
Good to see you.
Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August's Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs. and you can follow her on social media with the handle @CatVetSusan. Dr. Jolle Kirpensteijn is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Jolle works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GVETSX. Of this podcast are those by Dr. Susan Little and Dr. Jolle Kirpensteijn. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian.
Both Dr. Susan and I sincerely thank Jake Adams for composing and performing the music.